So you're doing an epidural on a bigger patient and you can't feel the patient's spine when you're palpating. What do you do? So normally I'm palpating for the spinous processes and feeling for the little spaces in between them. But sometimes you can palpate and palpate and you're like, I genuinely have no idea where the spine is. And I want to clarify, when I say bigger, I don't mean BMI 25, 35. I'm talking about BMI 55 or 65 plus. So what do you do? So first, it's important to understand that you can palpate deeper, and sometimes the spinous processes are there. They're just buried deeper than you're used to. And honestly, palpating a bigger patient's back is a skill in and of itself, and that's where doing hundreds of epidurals really helps. But there is another option that can be actually really useful here, and that's ultrasound. The same exact ultrasound that's used to look at the baby can also be used to find the bones in the back. People ask, well, why don't we just use the ultrasound for everybody? Well, for one, it takes time and you don't necessarily need it. So if a patient is in painful labor and she's contracting every couple minutes, bringing in the ultrasound can take a lot of time and can make the patient very uncomfortable. But of course, if the patient has, say, obesity and then scoliosis on top of it, and you really want to know where you're going because otherwise you just be guessing, then at that point, it's really useful to use the ultrasound. But for 99% of people, you can trust the anatomy, estimate the landmarks, and then just go for it.